You mentioned Dr. John Torres. Let's bring him into the conversation, our medical correspondent. Dr. John, we know that everyone's encouraged to, if they can have an outdoor gathering, have that outdoor gathering instead of an indoor gathering. But not everyone, especially if you live in a colder climate, you really can't do Thanksgiving outside. What's the CDC tell us about keeping indoor gatherings safe?
And you're right, Craig. I'm in Colorado right now. It's 25 degrees outside. Nobody would go out there and have a gathering. But the thing to remember is this year holidays are going to be a little bit different, but doesn't mean they can't be fun and they can't be exciting. So a couple of things to think about. If you can't be outside, be inside, but open a window, turn the heater on if you need to, but try and get that fresh air moving across the house so you can dilute that virus out and limit the number of people that are coming this year. And, don't tell the ones you're not inviting them, but the ones you invite, say, hey, we're limiting the numbers. We just want our special friends and family here with us. And then instead of going to every single holiday, pick one holiday. Pick the one that's most important to you and make that the special one this year. And then minimize contact when people come into the house. So typically we hug and we kiss because it's the holiday season. Don't do that this year. And then for Thanksgiving, you saw Vicky's Thanksgiving layout there. Typically, people go through with a plate and they get the turkey, they get the mashed potatoes, they get the gravy. This year, have somebody serve everybody. So they clean their hands. They're the only ones touching the utensils. There's individual condiments for people. And then think about that 6-foot rule. If people are inside your own household, then you don't need to have that 6-foot rule. But if they're outside your household, 6 feet, wearing masks is going to be important. Obviously, take it off when you eat, but you want to keep safe. That's probably the biggest thing here, especially for people that might be more vulnerable, the elderly and those with pre-existing medical conditions.
Really useful information there. Dr. John, to Hoda's question here, is the simplest solution to just make sure everyone gets tested before they show up?
Testing is, as Vicky said, a good idea in some cases to make sure that people aren't sick, especially if you don't know what they've been doing over the last couple of weeks. If you don't know if they've been safe. But testing itself does not mean that you have a free pass to not wear a mask or social distance. Even if you test negative, you still need to follow these rules. And so testing might be a good idea to add on. And if people are positive, they definitely should not come. But even if they're negative, they still need to follow all the rules, Craig.
Really quickly, while we have you, Dr. John, a couple of days ago, the First Lady, Melania Trump, she revealed that part of her treatment for COVID-19 was taking vitamins. Is that part of what folks who are suffering with coronavirus, is that something they should be doing to boost their immune system?
Craig, as a doctor, we get this question all the time about vitamins, and vitamins are important to keep you healthy and keep your immune system healthy. But what they don't do is they don't cure coronavirus. They don't prevent coronavirus unless you've had them build up in your system over a long period of time. So taking them right now, just short-term period to try and help, the best thing to do is eat a healthy diet and exercise, those boring things we always talk about. Although, as Dr. Fauci said, he himself is taking vitamin D. If your levels are low, vitamin D might be something you could take, but otherwise, just eat healthy.
All right. Dr. John, thanks as always, sir.